we are able to give to the family floater what we are currently running in the Andhra, the successful project, as well as in Tamil Nadu. It's basically because of the data management of the disease load. We have now drilled down and able to say the tertiary care, what is the disease load per lakh population in a very clear-cut manner per lakh basis according to the geographical distribution. We have our data management well within time. We are able to even forecast. Today, on a single day, we are able to give the settlement to the different categories. I could say today what is the number of cardiac procedures will be undergoing, the geographical distribution wise, and what is the distribution of this major categories disease load in the population. We have even drilled down to the men, women, children, and the age category wise. We have a data, and we have our own in-house data, and also we have ensured the cost factor is also kept within 2% of the total premium cost which we have done. That is another crucial factor which I have been very keen on it, because as you say, know very well, using technology and warehousing should not also increase our rates also. These are the two crucial factors.
So your goal benchmark is 2% of premium cost is devoted towards technology. Is that how I should understand that?
That's the current cost which we are able to.
Good. Sanjay, I think about a year ago or so, you moved claim processing in-house. That must have been a tough little challenge, you know. And besides the operational challenges and everything, it involved creating a lot of technology, partially from scratch, partially what you bring in. So what were the challenges and what were the triumphs? Because I would understand that now it's quite stable.
Yes, I think we took a dual approach. We also, felt that it was necessary for us to, get closer to the customer as well as the providers in terms of, handling, claims, because that would give us a clear understanding of the customer psyche in terms of how he expects and, get service both from us as well as the provider. And also to understand providers' issues, it was important that you get close to them, in terms of understanding. So there are segments which we pulled in house, and where we've started, understanding a lot of, what happens in that particular segment. What it is, what we've done is, we've tried to do this entirely on a technology platform. We believe that, if you've got to scale and you've got to handle it, efficiently, and simply for the customer, it's important that we keep on using, technology in whichever manner which we, operate each segment of the process. So, we've also, started partnering with other technology platforms to make sure that the entire process is seamless. What we would, of course, welcome, and what we would like to happen, especially in the urban retail and the group space, is to make sure something like what's happening on the mass health space happen, where technology is basically used to it, even at the provider space. Something like that happens very, soon, so that the entire flow from the provider side is digital, right, in terms of information. That would bring about a revolution in terms of the entire workflow, as well as the way we're looking at giving service, understanding costs, and making sure that at the end the consumer benefits.
Okay, great. Malti, knowing that insurers are moving claims in-house is never good news for TPAs. So, but that's a trend, and there's various reasons why people are doing it. But I think that also creates an opportunity space for a TPA, because they start to think about diversifying their services and to get into additional services. And then some of those services, like say disease management or very specialty services, again, there's a greater role for technology, So projecting down the future, not specifically for eMeditech, but for the entire TPA industry as a whole, like say 5 years or maybe, an 8-year horizon, how do you think they might evolve and render different type of services, and how would they go about rendering them?
Yeah, sure. We don't want to be out of business and out of job, right? So we have to evolve, I think, and change along with the times. No doubt, some of the private sector, large private sector players like ICICI Lombard and the new players have in-house teams to manage their claims and customers. And in fact, there is a talk about the general insurance in the public sector also moving towards their in-house TPA. While that is a big challenge to us in the immediate future, that how do we cope with that, and then how do we manage our business during that period, it definitely offers an opportunity to look for new ways of providing services or filling the gaps which the centralized operations of the players, we could support them at the local level because these operations are central, their operations are central. So at the local level, maybe it's an inspection, verification, or activities that need to be provided at the hospital end or at the point of delivery end, which could be supported by us. Or the outreach programs like RSPY, where the massive programs which are too huge for anyone single-handedly to manage. Number two. Number three, as you said, that managed care or providing a gatekeeper concept. TPAs traditionally what they provided was a network of hospitals where the customer could go and avail of cashless. Now, as the products would evolve, I would assume the products would include diagnostics, dentist, OPD plans, and lot more other things. So if we could create that network and provide cashless and those, in those top-up products, that would be another area. So these are the areas where I feel that, and then of course there is a lot of talk about prevention and wellness. So how do we deliver those services along with the insurance companies? The way I look at it, the TPA industry would definitely, maybe the shape and content of our services would undergo a change from what it started 10 years, 8 years ago to 2 years from now or 3 years from now. But since the healthcare space and the financing of healthcare through the insurance mechanism is growing at 40-50%. So there is scope for everyone to add value. And adding value has been the TPA's basic role, and subtracting cost, like at the minimal cost. What I feel is that the operation, the cost that the TPAs charge to the industry is I think practically 1/4 of what it would cost or 1/3 of what it would cost in-house. So we could evolve and produce more services at a lower cost, which support their in-house operation. I think that's how I would see the industry evolving too.
Great. Stephen, we have, there's one thing we haven't really, from the insurance aspect, really gotten into doing in India yet, but which may be happening in some other markets that you're familiar with, and would like your views on that. It is, how are people using technology to measure provider quality and developing quality benchmarks, especially in benchmarking providers, and is there some things happening in the nearby region? Because we know how it's done in States or in some European markets, but when we look from India, we like to look at something that's a little bit more similar and more achievable, because some of those things could be a little bit far off, And is there anything like that happening, say in the neighborhood, where whether it's insurance or government, how they're able to tap into hospital systems, or how hospitals are pushing some information which enables them to create quality benchmarks and measure quality at provider side?
Sure. I think there is no one size fit all, as we all know, right? And I think in every country, whether in Asia or even in US, I think there is now one very popular word: reform. So everyone is going through the reform of their healthcare. What the US has done is that they know that the GDP spending on healthcare is too high. So now they are actually going through how to define the meaningful use of using the EMR, right? And that is one of the areas they want to make sure that quality care are being given there, as well as those that are uninsured are actually having the accessibility to healthcare as well. Back to Asia, okay, a very interesting thing is that in Japan, okay, let me give you a few cases. In Japan, they are also going through another phase of healthcare reform because they are the oldest country in the world, right? They have a high population that are above the age of 65. And what is going through now is that they have provided great quality of care, by the way. But again, it becomes such a burden to the governments that they have to reform in terms of itemizing the healthcare bill, okay, making sure that the elderly are having the right level of care. And they are also building the regional healthcare information organization we call the RIOS, where actually health information are being shared. So in Japan, there is also a